postgraduate. The Faculty of Pharmacy's strategic vision is to become the center of excellence in pharmacy education and research in Malaysia, in line with UiTM's aspirations to produce world-class and holistic graduates. UiTM offers programs in 4 engineering disciplines, namely mechanical engineering, electrical engineering, chemical engineering, and civil engineering. At the Faculty of Applied Sciences, conducting experiments and laboratory work are the main methods of learning. The students are trained to develop strategic thinking attributes and skills and extend their learning experiences beyond academia. The Faculty of Hotel and Tourism Management, one of the pioneer faculties in UiTM, was established in 1967 at the Jalan Othman campus, Petaling Jaya. It is a leader in hospitality education, offering courses of all levels, from diploma to postgraduate. The Faculty of Accountancy has come a long way since 1956 with the setting up of the Rida College in Jalan Othman, Petaling Jaya. The faculty is the first in the country to offer the Association of Chartered Certified Accountants (CCA) in 1967, along with diploma and later degree programs in accounting soon after. UiTM is the first institution of higher learning in Malaysia to offer programs in the field of sports management, leisure, recreation, and sports science since 1995. In 1996, the faculty offered Master of Sports Science in collaboration with the University of New South Wales, UNSW, Australia. This was the first postgraduate degree in sports science offered in Malaysia. Music was first offered at ITM in 1980 as an elective subject. The faculty began offering diploma courses since 1984 and has now become one of the notable music faculties in the country, making UiTM the first higher education institution in Malaysia to offer a degree in music. Students of the Faculty of Law have won accolades locally and internationally, putting UiTM on the world map.
Testing.
Right. You gotta keep your chest up, your head up, your back straight, and your shoulders up. Also, remember to take a little break every hour or so whenever you're working or whenever you're gaming. Now, for some exercises that you can do, you gotta keep your back straight. You can roll your shoulders backwards for a set of 10, and you can also roll your shoulders forward for a set of 10. So, 10 forward and also 10 backwards. Lastly, you can do the stretch at your desk. You can put your hand above your elbow and you can stretch your elbow. Lastly, you can do the stretch at your desk. You put your right hand above your elbow and you pull it down and you drop your hand at the opposite side. You want to hold at this position for about 10 to 15 seconds. This will be able to stretch out your trapezius muscles and help you to relax your back as well as your neck. These are little stretches that you can do right at your desk. Remember, posture is really important, so keep your back straight, your chin up, and your shoulders square. Next, I'm going to show you some tips and eye exercises that will help eye strain due to computer vision syndrome. Let's take a look. A lot of us these days are spending more time in front of a computer screen or cell phone throughout the day, and when we spend this much time on a device that is only a few feet away from our face, it can cause muscle strain to our eyes. So, tip number 1 is to take frequent breaks. When you stare at a digital device for too long, your muscles will start to cramp up, and we call this as the accommodative
Assalamualaikum and a very good morning to all honorable judges, professors, doctors, lecturers, and fellow friends. Welcome to the second day of 11th UiTM Dental Student Scientific Symposium. Our theme this year is Dentistry Against All Odds, Revolutionizing Research and Practices. This e-poster presentation is streamed on our live telecast YouTube channel. Therefore, we would like to request all presenters and all symposium participants to fill in the attendance link on our website for this morning session. I am Adlina Zulkifli and I will be your moderator for this morning session, followed by Izzat Arif as our timekeeper. Now, we are really honored to have the Associate Professor Dr. Aida Noashika Abdul Rahman from Faculty of Dentistry, UiTM, Technologist Nohayati Muhammad Zain from Faculty of Dentistry, UiTM, and Associate Professor Dr. Nur Intam Abdul Murad from Faculty of Dentistry, University Malaya, as our panel of judges for Magnolia 2. Before we begin, please allow me to lay down a few house rules for today's session. Presenters must be ready at least 10 minutes prior to your allocated presentation time. Presenters are required to use the provided virtual background provided on our website for the live Q&A session. The pre-recorded video presentation will be played by the committee for 10 minutes and subsequently followed by a 5-minute Q&A live session by the judges. Please ensure your camera and microphone is turned on only during this session. The first bell will be rung at the 4th minute of the Q&A session. The second bell will be rung at the 5th minute of the Q&A session, and the last bell will be rung at the end of this session. Now, without further ado, let's start with for today's poster presentation by Adam Haris bin Azlan and Muhammad Faris bin Muhammad Sobri with their research topic of knowledge, attitude, and perceived harm of vaping behavior among medical and dental undergraduate students in UiTM.
Assalamualaikum and greetings to the honorable judges, Versas timekeeper, fellow friends and members of the floor. I am Adam Haris and along with me today is my partner Muhammad Faris. For this Dental Student Scientific Symposium, we will be presenting our research entitled Knowledge, Attitude and Perceived Harm of Vaping Behavior among medical and dental undergraduate students in UiTM. Before we start, we would like to give very special thanks to our supervisors, Dr. Nur Faiza Buhari, Dr. Nur Nazaya Bakri, and Dr. Nawal Alwani for guiding us throughout this research and finally made it to this day our first participation in a scientific conference. Moving on, let us start with the definition of electronic cigarette. The electronic cigarette or e-cigarette is an electronic device that contains a cartridge filled with liquid nicotine and other chemicals that produce inhalable smoke, also known as vape. Nicotine is the primary addictive component in cigarettes and is present at varying levels in many e-liquids. E-cigarettes or vape usage has been increasing among adolescents in recent years. The increased prevalence of vaping may be due to the widely accepted perception that it can be used for nicotine cessation therapy among tobacco users. It is also worrying that adolescents will initiate this vaping behavior although they are not tobacco users, just to keep up with the trend of vaping and may ultimately lead to tobacco use. There are a lot of arguments whether or not vape can be used as a harm reduction tool for smoking. However, more studies on the effectiveness of using vape as smoking cessation tool in the local context needs to be done. Today, we are the future healthcare professionals. Healthcare professionals have a prominent role in addressing tobacco epidemic. It is important to explore the diverse view of undergraduates towards e-cigarette, as this will help the relevant authorities to develop a standard guideline in the future. So the aim of our study, firstly, is to assess the knowledge, attitude, perceived harm of vaping behavior and mass media exposure of vaping products among the medical and dental undergraduate students in UiTM. Then to compare the knowledge level, attitude, perceived harm of vaping behavior and mass media exposure of vaping products in between the medical and dental undergraduate students in UiTM.
Conclusion. The bee pollen diet altered the microflora and antimicrobial peptides of oral cavity. This finding signified that bee pollen could modulate the immune system by altering the host microbe interaction. Thank you.
Thank you.
Section B, smoking status. Section C, knowledge. Section D, influence of mass media. Section E, attitude towards behavior. And Section F, perception towards health-related risk of vaping. For each section, scores were given and the cut-off points were as shown in this table. Medians were used as the cut-off point for the knowledge, attitude, and perceived harm domain, while mass media exposure, the cut-off point was 1. The inclusion criteria were medical and dental undergraduate students in UiTM, Sungai Buloh from year 1 to year 5. A total of 312 participants have answered the online questionnaire from July to August 2020. However, only 309 participants were included in the study due to missing responses during data entering and cleaning. Data were imported and analyzed in DSSS version 25. So for the results, the mean age of our participant was 20.6 with a standard deviation of 1.6. The majority of the participants are non-smokers and non-vapers and responded that they played a role in smoking cessation.
We have laid out 3 charted data that were calculated using Fisher's and chi-square tests. From the socio-demographic section, whether you're a preclinical or clinical student, have been taught on smoking cessation, and perceived that they play a role in smoking cessation were statistically significant when comparing between medical and dental students. The medical students who participated in this study were predominantly from years, as much as 62%, while the dental students were from the clinical years, 73%. 55.3% of the dental students knew they played a role in smoking cessation in comparison to only 44.7% out of the medical students. Majority of both undergraduates believe that they play a role in smoking cessation in their future career. The dental students have significantly higher votes in this than the medical students. We find this so because our participants from the dental population are majorly clinical year students, which means they have more exposure to clinical settings and meeting up with patients, rationalizing this matter in a clinician's point of view. Majority of them also have been taught on smoking cessation in their course. In contrast, most of our medical students that participated in our survey were pre-clinical year students, which explains their thoughts being recorded significantly higher and being unsure about their role in smoking cessation in their career later. Majority of them have not been taught on smoking cessation in their course. Next, we have table 1 that compares 4 domains between the medical and graduates. First, knowledge level, attitude towards vaping behavior, perceived harm of vaping, and mass media exposure on vaping products. The p-values obtained were all more than 0.05, shows no statistical significance. Both dental and medical undergraduates have poor knowledge. Almost fairly distributed number of people with more and less favorable attitude towards vaping behavior perceive vaping as less harmful than smoking and have less mass media exposure on vaping. Next, moving on to table 2, which shows the association of 2 pairs of data. First, knowledge level of e-cigarettes and the perceived harm of vaping behavior among all participants. And second, association of attitude towards vaping and perceived harm of vaping behavior among all participants. Both groups have poor knowledge about vaping. However, there was no statistical significance for the association of knowledge level with the perceived harm of vaping. From the study, there was statistical significance for the association of attitude towards vaping behavior with the perceived harm of vaping. The group that perceived vaping as harmful are more likely to have less favorable attitude towards vaping behavior. In contrast, those who perceived vaping as less harmful have more favorable attitude towards vaping behavior. Majority participants finding themselves responsible to take part in smoking cessation in their future career. The drive for education may enhance, changing the fate that young adults have low knowledge about what vaping could do to oral health. In a study by Martel in America, they are willing to consult dental professionals to discuss vaping. The findings from the study, where half of the medical and dental students perceived that vaping is less harmful to health, were similar to a local study conducted in Selangor among the general public, where the educated group mostly perceived vaping as less harmful than smoking and a useful tool for smoking cessation. Majority of the participants has low knowledge of e-cigarettes, similar in the study by Minhat in 2017 among undergraduate students in UPM. While low levels of knowledge is a possible barrier in providing education and guidance to patients, we should equip students with sufficient knowledge for future education. This study has some limitations. Participants were chosen from members of healthcare students, and as a result, they are more likely to give negative feedback on electronic cigarette use as a smoking cessation aid, resulting in social desirability bias. Small sample sizes restricted further analysis. In addition, the lack of comparison perceptions among medical and dental undergraduate students in UiTM who are currently using electronic cigarettes is another weakness and limits the full picture of the role that electronic cigarette may have. To sum up all that we have discussed, UiTM medical and dental undergraduates have less favorable attitude towards e-cigarettes, but lack knowledge pertaining to the issue. They also perceive the e-cigarettes to be less harmful to health. We need to understand that health practitioners are in a unique position to affect cigarette smoking rates, which could lead to a reduction in related mortality and morbidity. As a part of their role, healthcare professionals should prepare those involved in tobacco and e-cigarette consumption or dedicated to health sector to be supportive in smoking cessation. They are seen as experts with the most knowledge about health in the community. Therefore, there is an urgent need to further educate and proper guidelines needed to regulate vaping behavior among the population, especially within the national policy. That's all from us. We thank you.
Thank you, presenters. Now we welcome the judges for the Q&A session.
Good morning. Assalamualaikum, Adam and Faris. Congratulations for your very good presentation. Prof. Norintan, would you like to ask the question, please?
I thought it's you and Ayati.
Okay, all right. So, thank you very much, Prof. Norintan. Okay, so, Faris, can you tell me, in conclusion, what you have found from your study? In a very, very brief conclusion. And tell me why it is different than the studies that's already published.
All right, Assalamualaikum everyone. Thank you for the question, Prof. Okay, conclusion. This the study has been carried out in UPM before, and we are duplicating this study in UiTM here to find out the knowledge, attitude, and perception among our students. And I think that it is different. How it's different from other studies is that this study is going to be very beneficial for us because we are practicing smoking cessation. So it is going to give us the knowledge, attitude, and perception of the students here. And from there, we can use the data that we have collected to set any guidelines or set any baselines for our education system.
Okay, thank you. And is the finding similar with the findings in UPM? Adam?
The findings is quite similar, Prof.
Yeah, okay, it's
Yes.
similar. So what's next? What is your next action after finding out that the knowledge is not of our students are not up to it's not very good for the vaping?
Assalamualaikum. Okay, thank you.
Salam.
Thank you for the question. First, we hope that our study can be used for future studies, or either can be used for a reference for developing guidelines in the future. Other than that, because of the low knowledge in e-cigarettes, we hope that a guideline based on scientific evidence can be done, and then either the management may include e-cigarettes as a learning outcome in their courses with enough scientific evidence.
Thank you very much. I pass the question and answer session to Madam Nohayati.
Okay. Assalamualaikum Faris and Adam.
Madam.
Boleh dengar ya? Okay. Thank you for the interesting work and presentation. Okay. I just would like to know, okay, you mentioned that the limitation, one of the limitation is small sample size, and your response rate 209. And you are actually involved two faculties here, medicals and also dental. So I would like to know how you actually choose your respondent. From why you only send this questionnaire or this survey to this group of people, not to the whole, maybe the whole batch of medical or the whole batch of dental? Because if you really want to investigate, okay, their knowledge, their attitude on this matter. Any comments on that?
Okay, thank you, Madam, for the question.
Mhm.
Actually, we distribute to the whole batch of medical and dental. First, because we dental and medical practitioners, we involved in smoking cessation clinics. So because of that, first we choose them as participants. So regarding that is because the feedback we receive from them is according to batches. So some of the batches didn't give us enough feedback. So we collect with enough sample size that we have.
Okay, so you did send to all of the students. So
Yes.
what's supposed to be the total number?
309 participate, but we've sent to all batches, which was around supposed to be more than 1,000 students.
Okay. Okay, so means your this one only 309 that respond. So did you make any effort to improve the response rate? Did
At
you
first, we gathered the minimum number of respondents that we're supposed to get from our calculation using the software was supposed to be about 200. We actually achieved 200 at first, but we managed to blast the link survey and try to put in more effort, and we managed to get 309, madam.
Okay, it's
Alhamdulillah.
okay. Alhamdulillah. Okay. Okay, I think that's all from me.
Can I just ask one question? Because I'm just curious, because you said that majority they were not smokers, but some were smokers, right? Because I think about 3 or 4% they were smokers. Would you know the characteristics of these smokers among medical and dental students? Did you look at it? Were you curious when you analyzed the data?
We didn't find out individually.
But you can
But
actually do a cross step, right?
yes, yes,
Yeah.
Prof. That's a very interesting question. Thank you so much for that, Prof. Really
Because
looking
that
forward
would
to that.
impact, because you give some suggestion on how to improve teaching, right? In relation to all these smoking cessation. But if some of you, okay, are smokers, I think you need to influence your peers first. Okay. I'm just curious whether when you analyze, because when you analyze, sometimes you find out something, something different, and you should look at the characteristics. It's okay. All right. Thank you. Good presentation.
Thank you, Prof.
Thank you, Prof.
Thank you very much. Yeah.
Okay, thank you, judges and presenters. Before we end for today, we would like to present the certificates for the presenters for your participation in the symposium. Okay, this marks the end of the e-poster presentation for this symposium. There are several programs ongoing, so stay tuned for the Symposium live telecast YouTube channel on our website www.uitmdentistry-symposium.com. At 10:30 a.m., we are having a special care dentistry innovation competition, and later at 2 p.m., we are having a plenary talk by Prof. Dr. Yang Guk Park from Kyunghee University, Korea, followed by a closing and award ceremony. Thank you all for attending. We hope you have a great day ahead. Thank you.
loves me like you used to. Sometimes we're not ourselves. There's no one I can turn to.